So, welcome to our maintrac online forum. This is the third one of four in 2025. The topic today is circulating epithelial tumor cells and circulating cancer stem cells in prostate cancer, the evaluation of clinical potential. Speaker is Professor Dr. Katharina Pachmann.
So today we will talk about circulating epithelial tumor cells and cancer stem cells in prostate cancer and their clinical potential. Prostate cancer is one of the most frequently diagnosed cancers in men, and there are 1.5 million in 2022, and 1/5 of them die from prostate cancer. If it's diagnosed at an early stage and localized, the 5-year relative survival exceeds 99%. But if it's diagnosed at an advanced stage, then the 5-year survival rate drops to 30 to 37%. And the most frequent risk factors are age, family history, ethnicity, diet and lifestyle, and hormone factors, and chronic inflammation. The tumor diagnosis is a devastating event. The Latin word tumor means swelling, but in a more specific medical sense, a tumor is defined as a benign or malignant new growth of body tissue. It's derived from dysregulation of cell growth, and imaging techniques such as ultrasound and so on can detect tumors from about 0.5 centimeters in size. The structure of the tumor can provide clues about whether it's benign or malignant, but the definitive diagnosis can only be made from tumor material analyzed by the pathologists, by the biopsy. So cell growth is assumed to begin with a single tumor cells that multiplies. And after 10 doublings, it's about from 1 cell to 1,000 cells. After 20 doublings, it's about 1 million cells. And after 30 doublings, it's about 1 billion cells. A tumor of 1 centimeter contains about 1 billion tumor cells, 1,000 times 1,000 times 1,000 cells. The spreading of the tumor cells in blood requires blood supply for further growth. So the nutrients reach the tumor through the blood, and at the same time, cells can also leave the tumor. And these tumor cells can then be found in blood, and they can remain in the bloodstream for long times and spread throughout the body. These cells can exit the bloodstream at other sites and then grow into metastases. So this is a model of the bloodstream nourishing the tumor, but at the same time, these blue cells can exit from the tumor and get into the blood. Some of these tumor cells can then exit the bloodstream again and double and grow and even differentiate the light blue cells. And this is then a metastasis developing. It's the metastases that are the big threat of tumors in the body, not the individual tumor itself. And these cell doublings or cell divisions can occur rapidly or slowly. Rapid growth means doubling of cell numbers in 1 month, or slow growth, doubling of the cell numbers in 6 months. Until they are detectable, it takes some time. So this fast-growing tumor, the doubling time would be 1 to 3 months. This makes approximately 2 to 3 years until the tumor becomes detectable by imaging. So if a patient undergoes annual PSA testing or imaging, PSA increasing and the tumor is not detected, but only a few months after the last examination, the tumor becomes clinically apparent, and this would be called an interval tumor, but this is rare in prostate cancer. But still, if cells have already been shed, they can settle and grow in a similar rate as the primary tumor, and then metastasis may appear in about 2 to 3 years after the initial diagnosis. And this is shown here. So the tumor grows, and here it can be detected and removed. But at this time, when the tumor is still not detectable, it can start shedding cells. And if one cell grows at the same rate as the primary tumor, it can be visible in about 3 years. On the other hand, if the doubling time is around 6 months, it may take 12.5 years until the prostate tumor becomes detectable. And if a patient undergoes annual PSA testing and imaging, the tumor is detected during routine diagnostics. And if tumor cells have already been shed and settled and grow at the same rate as the primary tumor, metastasis may remain undetectable for even 10 years after the initial diagnosis. So based on the tumor size alone, it's not possible to determine how long the tumor has been growing and when it will form metastasis. So this is a slow-growing tumor, and here it's detected, but the cells can be shed already at that time when the tumor is not detectable yet. And if they are growing, they will not be detected even after 10 years. So there is the question, if a patient is like 78 years old, it can take until he is 90 years old until the metastases are detectable. And then there is the question what the patient should do to avoid metastasis, because surgery of the tumor is an easy way. So maintrac is a minimally invasive procedure that allows detection of living circulating cells also during prostate cancer development. We can do cell counting, we can do substance testing, we can do maintrac therapy relevant tumor characteristics, and we can do STEM-track tumor spheres, which detects the most aggressive part of the circulating cells. We have epithelial EpCAM antigens on the tumor cells, which are not present on blood cells. We have an antibody against this surface antigen, and then we can detect the cells. It's fast and reproducible and performed in a certified laboratory. Here the workflow, we only lyse the red blood cells, which are 1,000 times more than the white blood cells. The small sediment is then centrifuged down, the cells are labeled, and the automated microscope can detect the tumor cells. And here is a gallery of such cells. The rightmost gallery are the living cells with a nice nucleus and good staining. The middle gallery is cells that are questionable and they have already lost often their nucleus. And the leftmost gallery are the cells that are just in process of dying, where the nucleus stains with a red fluorescent dye, telling that these cells are dying. So do you have any questions here?
There's one question to the cell gallery. What is the maximum time dying cells can be observed? What is normal?
Well, we have done analysis on this issue, and we have shown that the tumor cells in blood can survive under ambient temperature up to 6 days, but we hope that all the samples arrive at our lab at about 72 hours maximum, and then we can detect all these cells.
There are no more questions.